Most of the time, it's not a triple tray that will make a patient gag when you're taking an impression for a single unit crown. It's the full arch runny alginate, that it's going to make somebody gag. So when I saw that Premier had actually come up with a solution for this, they actually have an alginate double arch full mouth triple tray. And so you can see a picture of it here. You'll see me use it on that last patient in just a minute, because we are making an occlusal guard for her. But it's going to get upper and lower at the same time. It's virtually gag proof because, first of all, it's palate free. If you look here, you can see that there is no palate, so there's no reason to load that. It's kind of like when we used to take bleaching impressions. We would use a lower tray for the upper arch because we didn't need a palate for a bleaching tray, and there was much less chance we were going to gag somebody if we used a lower tray on the maxillary arch for a bleaching tray, because we didn't need any palatal or soft tissue information. And so that's what Premier did. The palate is gone from there. As you can see the T-locks on the front of that as well, which is fantastic. So we're going to have those locks helping to hold the alginate in place, and it's a closed mouth impression. That's the thing that really makes it gag worthy for most of these, is having to hold your mouth open the whole time. When a patient can close, whether it's during an injection, like patients who are really afraid of lower blocks or of needles, they do really well with PDL injections on lower molars. I use something called the STA device, and if their mouth is closed, they do much better. You can give an akinosi, which is that block, that alternate block technique where you go across from the maxillary second molar and essentially almost go where you're going with the Gow gates, but a little bit lower. Anytime the patient has their mouth closed, they feel more comfortable. I just think as mammals, we are not comfortable with our mouth open laying on our back. It's a very vulnerable position. So the fact that you put this in and take the upper and lower at the same time, and the patient closes into it. So now they're closed in the front, they've got their tongue holding anything back that might be here, and because it's palate free, there shouldn't be a ton of excess material back here. It's a very comfortable way to take impressions. And the first time I did this was a couple years ago on my son, and I told him we had a magic no gag tray. Well, it wasn't magic, but here's how it worked, and we had a no gag tray, and he still used the rinse that time, but the next time he did not use the rinse and did not gag anymore. And so either I'm wonderfully powerful with my power of suggestion, but I don't think it's that. I think it's the fact that now, instead of having his mouth open and drooling and feeling kind of like he's gagging, the ability to close down and get back to your vertical dimension is going to keep him from gagging. It's going to cut the chair time in half by taking upper and lower impressions simultaneously, so it obviously goes a lot quicker. And I noticed one day that some of our old metal trays, by the time they go through the sterilizer, 50 or 60 times and start to get a little bit rusty and disgusting, they tend to look a little gross, and to us we know that it's functional in the sense it's just holding the impression material. But there's times where I look at those trays that are all beat up and ugly and think, what would I think of if I walked in to have not that this is surgery, but what if I walked into a physician's office to have something done, and he pulled out something old and rusty like that and stuck it in my body cavity, or in this case the mouth, and I'm like, you know what, I really like the look of these better than I do those old metal trays.